Define normal labor. What are the stages of true labor? Describes the management of first stage, second stage, and third stage of labor in detail. Normal labor is the natural process in which the baby is delivered through the birth canal after 30 to 42 weeks of pregnancy with regular uterine contraction, progressive dilatations of the cervix, and without any complication, usually with the baby in head first position, vertex position. Stages of true labor. True labor has three stages: first stage, second stage, and third stage. First stage of cervical dilatation, and second stage of expulsion of baby, and the third stage is the stage of delivery of placenta. Next, management of first stage of labor. The first stage of labor begins with the true labor pain and ends with the cervix becomes fully dilated 10 centimeter. It is the longest stage of labor. It has two phases: latent phase and active phase. Cervix dilates from 0 to 4 centimeter in the latent phase, and in active phase cervix dilates from 4 to 10 centimeter. Strong contraction. Next, management of first stage. Admission and initial assessment. Record mother's name, age, obstetric history. Check vital sign, pulse, BP, temperature. Assess uterine contraction. Check fetal heart rate. Perform abdominal and vaginal examination to know cervical dilatation and position of the baby. Monitor the mother. Check pulse every 30 minutes. Check blood pressure, BP every 4 hours. Observe temperature regularly. Observe the progress of labor using heartograph. Monitor the fetus. Check the fetal heart rate every 30 minutes. Observe for any signs of fetal distress. Next, comfort and emotional support. Reassure the mother and reduce anxiety. Encourage deep breathing and relaxation. Allow the presence of a support person if possible. Position and activity. Encourage the mother to walk or change position. Avoid lying for a long period. Neck bladder care. How can we care our bladder? Encourage the mother to empty bladder every 2 to 3 hours. A bladder can slow the progress of labor. Nutrition and hydration. Like provide light food and fruits if allowed. Maintain proper hydration. Hygiene and prevention. Maintain clean labor environment. Use sterile environment instruments and gloves. Perform hand hygiene. Pain relief. Teach breathing exercises. Provide if required as prescribed. Preparation for delivery. Prepare delivery tray if instrument. Arrange newborn care equipment. Inform the doctor if any abdominal signs appears. Management of the second stage of labor. Expulsion stage. This is the expulsion stage. This stage begins with the full cervical dilatation and ends with the breath of the baby. During this stage, the baby moves through the birth canal and it is delivered. Management of second stage. Preparation for delivery. Prepare sterile and delivery tray and instrument. Wash hands and wear sterile gloves. Ensure good lighting and clean environment. Prepare newborn resuscitation equipment. Position of the mother. Help the mother to take a comfortable position, usually semi-sitting position. Support her back and legs properly. Maintain privacy and comfort. Monitor the mother. Observe uterine contraction. Check pulse and blood pressure. Watch for signs of excessive and exhaustion. Monitoring the fetus. Check the fetal heart rate every 5 to 10 minutes. Observe the descent of the baby's head. Next, guiding the mother to push. Encourage the mother to push during contraction. Teach deep breathing and bearing down efforts. Allow the mother to rest between contraction. Next, delivery of the baby. Support the baby's head during crowning. Allow the head to come out slowly and gently. After the head is delivered, check for umbilical cord around the neck. Deliver the shoulders and the rest of the babies carefully. Immediate care of newborn. Clear the mucus from body, mouth, and nose. Ensure the baby starts breathing and crying. Clamp and cut the umbilical cord. Keep the baby warm and dry. Observation after the birth. Check the baby's breathing and color. Observe the mother's condition. Management of third stage of labor. Placental stage. The third stage of labor begins after the birth of the baby and ends with the delivery of the placenta and membranes. This stage usually lasts 5 to 30 minutes. Management of third stage of labor. Observation of the mother. Check the pulse and huh? After the head was delivered, immediate care. Next, observation of the mother. Check the pulse. Yes, next. Signs of placental separation. The nurse should observe the signs that the placenta has separated from the uterus, such as sudden gush of blood, lightening of the umbilical cord, uterus become firm and rises upward, change in shapes of uterus, delivery of placenta, assist in control card section to deliver the placenta, support the uterus with the other hand to prevent complication, allow the placenta to come out slowly and completely. Examination of placenta. Check the placenta and membranes to ensure they are complete. Make sure no part remains inside the uterus. Prevention of bleeding. Massage the uterus to keep it firm. Continue monitoring for excessive bleeding. Care of mother. Clean the perineal area, check for the tear and epistomy wound, make the mother comfortable and warm.